Moving on to a new set of disorders, we are now going to talk about eating disorders. This particular set of disorders, I often find that many students will have high interest in this topic. Some students have had history with this topic. Some students have concerns about this topic. So I do want to kind of, I guess you could say it's a trigger warning. I do want to make it clear to any student, if you do have any kind of distressing thoughts or temptations or anything that come up when we're learning about these disorders, please contact counseling services on campus. If you are watching this video and you're not in one of my classes, you're not on my campus, there should be services available to you, or at least hotlines or something. Please contact them, because this is one of those topics where I will have students, they will report to me like, yeah, that got me thinking, and I don't like where my thoughts are going. All right. So the thing about these disorders, eating disorders, you may have heard of them, or at least heard of some of them. We are going to talk about 3 eating disorders officially recognized in the DSM. One of them was added more recently than the other 2. And one thing we have to remember about eating disorders is that their symptoms are much more common than the actual diagnoses. And that's true in general with a lot of the stuff that we talk about. But symptoms of these disorders are remarkably common, particularly among college students. They're in an age group that where these subclinical eating disorder symptoms, at the very least, are quite common. Diagnosable eating disorders are less common. In fact, they are rare by their very nature. To get diagnosed with a disorder, your behavior should be rare, unusual, impairing. So these disorders are not as common as some of the symptoms that can go along with them. So let's address that. All right, so the first one that we're going to talk about is anorexia nervosa, and often we just say anorexia. And, oops, I am bumping into something here. Hold on. Making sure I can move to the side when I need to reveal the words here. All right, so anorexia. I hear this word misused all the time. Like if someone looks thin, sometimes people will say, well, she looks anorexic. And anorexic or anorexia does not equate to thinness. You can be thin without having an eating disorder, without dieting. Some people are just thin. That's their body type. That's their metabolism. That's their genetics. So let's remember that. Please don't go accusing people of having an eating disorder just because they're thin. All right. The other thing is, with anorexia, the official diagnostic criteria at this moment do require that someone be underweight. That is an important requirement. It's got a little bit of controversy because many people think that we do need to pay more attention to people who have other symptoms but are not necessarily underweight, and in some cases not underweight yet. But for anorexia, the requirement is that you have a BMI less than 18.5, which would be very small for many people. And we used to say, I know when I first learned about this, they would say like 85% of what would be considered a healthy weight for a person. But then generally they're using estimates of what a good weight would be. But the idea is that the person is supposed to be underweight. We do worry about somebody once they get to be underweight, particularly if they're underweight from food restriction, from dieting and starvation, not just because they're naturally thin. Because there are changes to the body, changes to the brain. The brain is mostly fat, and you start losing lots of fat. Your body it changes in functioning, and also you start to eat away at muscle, which is very risky. Now, for anorexia, the key feature is that food restriction. An individual purposely loses weight to a point below which is considered healthy. And that's the textbook definition there. Other people say instead of focusing on the losing weight part, we should focus on the food restriction or attempts to lose weight part of things. So some things you see with anorexia, in addition to the food restriction, you see things like body dissatisfaction, distorted body image. Like they may accurately describe that they are on the smaller end, but they'll be like, but I should be there. They very often are resistant to any kind of treatment or change. They often are in denial that they have a problem. Other things that you can see with anorexia is if a person is capable of menstruating, they can stop menstruating. They have something called amenorrhea. If somebody is very young when they develop the symptoms of this disorder, they might not start menstruating when it would be typical for them to start menstruating. And you can have anorexia in folks without the equipment for menstruation. You do have men and boys and non-binary individuals who also will have anorexia. It's being female is a risk factor. Way more females compared to males, and research is tricky because of the way that they've asked about categories. But there is a pretty strong favoring of females being more at risk for anorexia, but we do see more males coming into the picture, maybe because of society changes, emphasis on lean muscle mass and things like that. But yeah, it's not like someone who is male cannot develop this disorder. It's more common in females. It's not common in general. Less than 1% of the population actually meets the diagnostic criteria for a full-blown, clinically significant, diagnosable anorexia nervosa. Other things you see with this disorder, sometimes a person develops problems with temperature regulation, and sometimes the body will develop a fine layer of hair known as lanugo. You can also see this in newborn babies, particularly if they're preterm, and that hair was meant to keep them warm as newborn babies, but sometimes you can develop lanugo as an adult because of severe weight loss, and the body's trying to keep you warm, essentially. You can also have problems like you might have calcium loss in the bones, you might have things like risk for fractures, various things, increased bruising, various things can happen with this extended dieting, extended food restriction. And the very important thing that I do need to mention is among all the psychological disorders, anorexia is unique in that it has a high mortality rate, and the symptoms themselves are deadly. The actual symptoms like not eating or not eating much, they can lead to someone losing their life. And so, other disorders, they might increase your risk for certain risky situations, but in this case, the actual symptoms themselves can be deadly. It does have a high mortality rate, and it has a high relapse rate. People who get treatment, it's pretty common for them to relapse, to go back to old behaviors. There are a lot of difficulties with working with this disorder. Right? The other eating disorder that we're going to talk about is bulimia nervosa, which I will probably just say bulimia. A lot of times when people think of bulimia, they think of self-induced vomiting. That can be part of bulimia, but it is not a core feature and it's not required. You can have bulimia and never self-induce vomiting. So what is bulimia? Bulimia involves binge eating combined with purging. What are those things? Binge eating is eating a large amount of food in a short span of time or a single sitting. We don't have a standard definition of what counts as a large amount of food. It's a little bit tricky, but it is subjective. But binge eating combined with purging. Purging involves attempts to get rid of the food or get rid of the effects of consuming the food, trying to keep your body from absorbing the calories or whatever it is that someone might be worried about. And so you can have purging with self-induced vomiting, which is dangerous. All of the purging methods are dangerous in some way. Vomiting is meant to be a rare event that your body only goes through every once in a while, like when you're trying to get toxins out of your body or something like that. Frequent vomiting can be very dangerous because stomach acid comes up. It can lead to things like electrolyte imbalance. There are a lot of risks with this sort of behavior. Some people will also try to purge using laxatives or diuretics, basically medicines, pills, things that make you poop a lot or pee a lot. And the thing is, you're not really losing fat. You are losing poop and water, and they can be risky and lead to electrolyte imbalance and all sorts of problems. And then some people will try to purge through intense exercising. Like they might have a binge and then they will exercise for like 7 hours straight until they're ready to drop. And that can be risky because the intense exercise has its own risks. Someone might pass out on the treadmill, trip on the elliptical, pass out and get hit by a car. I mean, the different things can happen. It's not, it's not necessarily even though we think of exercise as healthier, it's the intense, sustained, extreme exercise that can be risky. And all right, so that's what you need for bulimia. People with bulimia are typically not underweight. They can be what we consider normal weight. They can even be overweight and be diagnosed with bulimia. And typically, people with bulimia, I think on average, they are, I have the statistics somewhere, but like on average, I believe that they are normal weight or above. And part of it is I hate to think of it as anything that could be effective, but it's not a very effective means even for weight loss, or you can't get rid of the food once it's in your body, sort of, or not completely, at least. It's not very effective. And it can lead to things like swelling and puffiness. And, so it's problematic for many reasons. Unlike people with anorexia, people with bulimia typically know they have a problem, and they can be very secretive about their behaviors. Now, we have a third recognized eating disorder, and this was added in the most recent version of the DSM. In DSM-5, they added binge eating disorder, and this is where you have the binge eating without the purging. So the core symptom is binge eating, almost like compulsive. Remember we talked about OCD, we talked about compulsions, recurrent episodes of binge eating without subsequent compensatory behaviors. Older terms might be compulsive overeating, but we're talking about binge eating disorder. And now that that's recognized, it's in the DSM, we have more statistics on it. Not surprisingly, it's the most common eating disorder among these three that we talked about. I'm not going to give you an exact number. Actually, let's see. I'm not going to give you an exact number, but it's the highest of the three. All right. So the textbook does go into some causes, explanations of eating disorders, and for this class, I am not going to go into great detail on that. If you want to go into more detail about the causes, the why of any of the disorders we're talking about, take the upper level class on abnormal psychology. But for this class, for my students, I just want you to know the definitions of what they are, what I covered in the video.